have you ever stopped to wonder, what if the very medicine designed to save us could also become our downfall? The invisible world of antimicrobials, which includes antibiotics, antivirals, antifungals and antiparasitics, is a complex field that demands our attention and understanding. It's in the careful management of these powerful tools that the future of global health lies. Consider the case of Mr. Smith, a 65-year-old man with a history of chronic obstructive pulmonary disease. He was admitted to the hospital with a severe respiratory infection. Initial tests were inconclusive, and in the urgency of the situation, Mr. Smith was started on a broad-spectrum antibiotic. Days later, when the lab results revealed the presence of a common bacteria, it was clear that a more specific antibiotic would have been more appropriate. Unfortunately, the misuse of the broad-spectrum antibiotic had already contributed to the development of antibiotic-resistant bacteria in Mr. Smith's system. This situation brings to light the crucial role of antimicrobial stewardship. The misuse and overuse of antimicrobials can lead to the development of resistant strains of microorganisms. When this happens, infections that were once easily treatable can become deadly. Antimicrobial stewardship programs aim to optimize the use of these powerful drugs. By using the most appropriate antimicrobial at the right dose and for the correct duration, we can effectively treat infections while minimizing the risk of resistance. Prescribing policies play a pivotal role in this process. They guide health professionals in making informed decisions about antimicrobial use. These policies are based on up-to-date research and take into account factors like the type of infection, the patient's medical history, and the local prevalence of antimicrobial resistance. So, what's the takeaway here? Well, Mr. Smith's case underscores the importance of correct antimicrobial prescribing. It's not just about treating the infection at hand, but also about considering the broader implications of antimicrobial use. Remember, each time an antimicrobial is used, there's a risk that it could contribute to resistance. It's like a game of chess. Every move has consequences, and to win, you need to think several steps ahead. To wrap up, the key points discussed include the importance of antimicrobial stewardship and the role of prescribing policies. It's about using the right drug at the right dose for the right duration. It's about considering the wider implications of antimicrobial use. The world of antimicrobials is complex, but with careful management, these powerful tools can continue to save lives for generations to come. Because in the end, it's not just about winning the battle against infection, but also about preserving the power of antimicrobials for future fights. So the next time you reach for that antibiotic, remember Mr. Smith and consider the bigger picture. Because every choice we make, every prescription we write, is a step towards either preserving or threatening the future of antimicrobials.